Hello, everyone. I'm Siobhan Carter, Interim CEO for the American Counseling Association. Welcome to today's Spotlight on State Sessions, and thanks so much for taking the time out to join us. A key thing that I've learned about counselors during my tenure at this organization is that ACA members are passionate about advocacy. Counselors just get it. You understand the importance of speaking out on issues that matter. You're also passionate about the people you serve. The well-being of your clients is a central theme in what ACA members want to advocate for at both the federal and state level. Your unwavering commitment to the counseling profession continues to shine through, even in our politically divided world. Today, we will focus on the most effective ways to advocate in your state. You will hear from state legislators and ACA leadership and staff about the events of the last state legislative session and what we expect to see next year. During the state spotlights, you'll hear from ACA state branch leaders on their legislative successes and where they see opportunities for growth. We are also lucky to be joined by state legislators from across the country who have taken time out of their incredibly busy schedules to be here with us today. Finally, we will hear legislative updates from our ACA State Affairs team on relevant state legislative trends and our Chief of Professional Practice, Lynn Lindy, on the Interstate Counseling Compact. We are excited to share our learnings with you and to provide a place for connection with others who are striving to make a difference close to home. And we look forward to continue to support your efforts as a trusted partner. With that, I'm pleased to introduce our 2025-2026 ACA President, Dr. Elsa Soto-Leggett. Elsa's accomplishments are too great to list in this short time, but by the way, I do still want to provide a brief introduction. She is a professor and practicum and internship coordinator at Truman State University in Kirksville, Missouri. With over 20 years in higher education, she's contributed to the education and supervision of professional counselors preparing for mental health and school counseling. Her work as a supervisor for provisionary licensed professional counselors and future play therapists traverses workplace settings and has contributed to the full cycle of the development of professional counselors. Her clinical experience, research, and publications focus on counseling children, solution-focused counseling, solution-focused play therapy, and supervision. A founding member of the Association for Child and Adolescent Counseling, ACAC, Elsa served as its president from 2013 to 2015. She continued to contribute to the Journal of Child and Adolescent Counseling as a member of its editorial review board. She was also the president of the Texas Counseling Association from 2022 to 2023. At her core, she is a dedicated servant leader with a deep personal interest in advocacy. Elsa, welcome to today's session.
Thank you for that warm introduction, Siobhan, and thanks to all of you for taking time to be here. Given that our politics are so fractured at this time, we are taking this opportunity to prepare you, counselors, counselor educators, and counseling students, to be great advocates for yourself, your clients, and your communities. Especially during these difficult times, our advocacy work does not stop. As Siobhan mentioned, my personal interest in advocacy is deep. I understand the importance of giving voice to those that don't have one, and to using our voices to amplify issues of importance to our communities. I also understand that we all have a different approach. What works for me may not work for you. So our aim is to equip you with a toolkit of strategies, tactics, and techniques that you can lean on, refer to, and to use in ways that feel authentic to you. One of my goals is to bring us all together to advocate on issues that truly matter to our profession. I believe we can work together to make tangible progress on the most pressing issues of the day. We are better together, and our advocacy work makes a difference. As you hear from our colleagues, legislators, and ACA staff, be sure to jot down your questions. Towards the end of today's events, we will open the floor to a live question and answer portion. You can save your questions for the end or ask them in the chat throughout today's session. Our state affairs team will be monitoring the chat and will do their best to respond in real time. Without further delay, let's get started. It is my honor and my pleasure to introduce my colleagues from the Texas Counseling Association who will begin our program. We are joined by Dr. Leslie Casares, TCA President, and Noah Jones, the Public Policy Analyst for TCA. Leslie and Noah, welcome and thank you for being with us today.
Hi, everybody. My name is Leslie Casares. I am the president of the Texas Counseling Association for this fiscal year, and I'm here with Noah, who I'll let introduce himself.
Hi, y'all. My name is Noah Jones. I am the public policy analyst for the Texas Counseling Association.
Fantastic. Noah, I know that we had our legislative year here in Texas this year. We are a biennial state where we only have it every other year. Can you tell us a little bit about the public policy days that TCA has at the Capitol and kind of what that entails?
Absolutely. TCA, we're a really unique organization in that our counselors are always working around the clock in a variety of settings. So a lot of associations you see out there, they have one day at the Capitol every legislative session. But because we respect that our counselors work in a variety of different settings, which means their free time might be a little bit different, we actually have 3 days, one in March and one in April and one in May. And those really help us to accommodate different counselors, different issues at different times. Um, and we had a very special advocacy days this year around. We had a lot of student participation actually this time. Many students came from across the state. We had some from San Antonio, Austin, Houston, Dallas, all show up, and we had great turnout there. Um, in addition, we had some state legislators turn out to join us. We had State Senator Kevin Sparks come out and speak to us, and State Representative Janie Lopez come and speak to us, who both sponsored bills for us this session that we were proud to work with them with. So it was a really impactful session, and it was great to see so many first timers come this time around too. And I like to say with advocacy, once you do it for the first time, it gets so much easier every time afterward. So it was great.
Absolutely. Yeah, that was going to be a question. You know, a lot of people are intimidated when it comes to any kind of advocacy because it seems so overwhelming to jump in there and do that. So, can you tell us a little bit about how TCA kind of overcomes that and what some of those items and materials are that you give people that are going to be coming? I know you did some pre Zooms and things for people to watch before they came to the Capitol, but what other things can we do to help make that an easier thing for people to do when they come to advocate?
Definitely. Well, if you're worried about getting involved in advocacy, I understand. It's a lot to kind of go into if you don't feel you're properly prepared for it, and that's perfectly understandable. What we did this year for the first time is before each of our 3 advocacy days, we hosted a Zoom webinar, a sort of know before you go each time, just so people could pop in and they could ask questions. Like sometimes it's just the littlest stuff that might throw you off on the day of, oh, where do I park? Where do I show up on the day of? What are we going to be talking about? And we can give you those little bit of insights so that whenever you show up on the day of, you're focused on getting there, getting your mission, and going to those legislator offices talking with them. Um, and we also kept up the recording just for posterity's sake, so anyone could see it at any time, make it flexible for people. And we had some fantastic feedback on that. People were really liking it this time around. And on the day of, we give you an orientation and we give you a ton of papers and a ton of materials to make sure that you know exactly what you're going to be talking about when you go into these representatives' offices. And I'd like to think that we have a pretty relaxed environment in which you can just come up and talk to us, ask us about issues if you're a little bit afraid. And we tend to partner up people, our veterans who've been there many times beforehand, with our first timers, just so no one has that intimidating experience of walking into an office alone by themselves. We like to foster togetherness, inclusivity, and just ensuring that our counselors feel prepared when they're walking into those offices.
I think that's great, especially with the amount of students that we did have this year, which is great. You know, I'm super glad that the graduate programs are really encouraging their students, or they're getting them all together and putting them on a bus or something and bringing them to the Capitol just so they can have that experience advocating as a student, so that when they do become a professional counselor, they're already going to have that experience under their belt. So it's a great thing that these universities are doing.
Absolutely. And that actually kind of slides into one of the things that got passed this session. One of TCA's biggest priorities was passing some work with student loan relief. Would you like to talk about that a little bit?
Absolutely. So we have been trying for several sessions now to do a couple of things with this. There's a mental health repayment plan in Texas, and that has included for a long time paying for graduate studies for people that have their professional counselor, or maybe they are a psychologist or different things. Um, this year, luckily, we were able to add school counselors, which have not been on that bill in the past. And that's a great relief, I know, for the people that are going through those programs to be able to submit for that loan forgiveness for getting a mental health program. And I believe that the amount of the loans also went up pretty drastically. I don't remember what it was before, but I think it increased by 20,000. Is that right?
Yes, it did.
Yeah. So I know, as a former professor and program coordinator for those school counseling programs, that was always a question I got, because it's very hard a lot of times to get financial aid in a graduate program. So this will definitely help, hopefully offset some of the costs for people that are going through and doing that.
Definitely. It's just all about trying to remove barriers for people to get into the counseling profession, and student loans are a huge issue. Um, yeah, and there's a ton of great little tiny things worked into that program as well. There's a few stipends for like staying past the term of the program to get some extra money. If you speak a language of need, you get some extra money. So we are super excited for the applications to open up for that in November. And rest assured, we are going to spread the word about that like crazy.
Absolutely. Yeah. And I think was rural areas also one of the components of that, so that they could get people out into some of the areas like where I live, that I call it a mental health desert. There's not a lot of providers out here in a lot of the rural areas. So it's great that they're going to add that as a talking point, right? To get people to come out to this area or other rural areas and do their practices there.
Absolutely. It's going to be a fantastic addition to the program, and I for one am super excited about whenever those applications open up. We did have a few other wins this year for our school council as well. We were able to get a guaranteed pay increase. Wasn't exactly in the amount that we were looking for because, it's hard to get education funding in Texas. But at the very end of the session, we did get a surprise with a bit of a increase in the payment.
Yes, we did. And I believe this was including the teacher pay raises and different things. And I'm going to say we all worked really hard to get the school counselors included, because for a long time, those were not included in this bill. I know it was very specific on the teacher pay raises. It's a little less specific on what counselors are getting, but hopefully the districts are being able to implement that additional allotment that's going to have that $45 per student on their average daily attendance, and apply that towards some of the non-teaching positions for people such as counselors. And it doesn't go to administrators either. So it's really a great allotment that's just going to be for those school counselors. What were some of the things that you think, Noah, that also applied to our licensed professional counselors?
I think a small thing that's really going to help this time around is that the term LPC associate has finally been added to the Texas state codes. There's been some issues in the past where the terminology was a little bit different in there. Some of the statutes implied that the LPC associate license was temporary somehow, and we know that's not the truth. So
It just rolls over into
exactly.
that being an associate, right?
So we were really glad to see that get put in this year. And additionally, the state of Texas is going to be recognizing Counseling Awareness Month for the next 10 years officially. We were
So great.
we were glad to see that. Generally, what we have to do is we have to go in every single year and just ask for a governor's proclamation. But we're super thrilled that for the next 10 years, the state of Texas will officially be recognizing and celebrating it.
I love it. And hopefully that's something that we can keep going, just because now that it's in, for the next 10 years, we can really start promoting it even earlier than we have been, waiting on those proclamations to get passed. I wanted to also talk a little bit, Noah, about the public policy priorities. There's a lot of P's there, right? So this is something that the board of directors does prior to a legislative year. So as a board, we kind of all gathered, we decided what are the priorities that we really want TCA to focus on as the legislative session comes up. Um, so let's talk a little bit about that, because we've got 4 big priorities. I'll mention those, and then maybe you can kind of say how those fit into some of the things maybe that we haven't touched on yet. So one of the things that we had is improving mental health and safety in school settings. And I do know that there was some money added to the school safety allotment, which would help with this. And some of that funding does go to mental health in schools. So that's definitely a win that kind of plugs in right there to our priorities. Another one that we had was increasing access to our professional counselors, protecting the high professional standards, and then advocating for those that are facing adversity. So out of those, is there anything that you want to talk about that we kind of promoted this year, or that we really pushed to maybe get through some bills?
Mm. I think that a really good one this year was increasing access for us. We did have it was a bit of a mixed session sometimes, right? Unfortunately, the Interstate Counseling Compact did not pass through this session, which obviously is a disappointment to us. But we did get improvements to access in other areas. I think we got some great strengthening of the counselor pipeline in Texas to build some counselors for the future. We got the mental health professionals pipeline program passed, which helps to kind of clear up a lot of the confusion when it comes to curriculum, and ensuring that if someone is trying to go out there and putting in the honest effort to be a mental health professional in Texas, that the curriculum standards are lined up for them, and that they're able to have easier access into these master's programs to ensure that they can take those steps to make sure that the next generation of counselors in Texas is able to have some of the steps put in place for them.
Yes, that's a fabulous one. And it's honestly, it's a great thing, because a lot of the universities now are going to have to kind of collaborate to see what that's going to look like as students are transitioning either from a bachelor's program into a master's program, or from master's into others. So I'm really curious to see how that pans out once they get the statutes kind of surrounding that bill.
And
I know another thing, Noah, I'm sorry I interrupted you.
sorry, go ahead.
We kind of, that facing adversity is a big one, because there's always a lot of bills that we know are going to affect the clients and the students of the counselors that are serving right in Texas. And that one can sometimes be a little bit more difficult to talk to our state legislators about. Is there anything about facing adversity with those bills maybe that we want to touch on?
Sure. In Texas, unfortunately, we face an uphill environment when it comes to talking about mental health. It seems especially when it comes to talking about school mental health. Um, a lot of state legislators don't understand or don't want to understand what the role of a school counselor is. And unfortunately, a lot of the bills that they pass aren't necessarily aimed at school counselors, but they have effects on them. They have effects on the role, and those kind of ripple effects affect everyone in the school environment. Um, so we've seen some of those bills get passed this year. In addition, we have to make sure that our LPCs are not having onerous requirements placed upon them. Um, we had to fight back on the defense against some bills about kind of dictating what kinds of continuing education requirements counselors were getting. They were trying to put some just anti-LGBTQ stuff in there for some reason, and we had to push back on that. Um, but it's important to sometimes recognize that in a legislative session, your biggest wins are the things you pass, and sometimes it's the things that you help make sure don't pass. The things that help protect counselors in Texas, protect the profession.
Absolutely. I think that's an important point, is that it's not always advocating for something to pass, but sometimes we've got to advocate that that's not going to be the best situation for those that are involved. So thank you for stating that, because I think that's important. I think we're about at time. Is there anything that we haven't talked about yet that you feel like we need to touch on?
I think we did get one more small win for the students in school was about their absences, if I'm
Oh, yeah.
not mistaken. Do you want to talk about that one?
Absolutely. So, one of the bills that passed this session was so that students who are in a K through 12 school will get an excused absence if they are out of school to see a mental health professional. And in the past, that's been varied based on the school district. So some school districts would allow that absence to be excused if a student was going to see their counselor. School districts weren't. So now that we have this bill, it's going to be a statewide requirement that those are excused absences for students, which is definitely a win.
Absolutely. It's so good to see that mental health is being destigmatized in schools for students that just need to go see a counselor.
That was definitely a big win. And I think we've covered a lot of the big wins that we've had this year. And I know that you're already going to start looking at what we can do for the next session, when it comes up here, not next year, but the year after, just because it's always ongoing, trying to meet with our legislators and get the word out about the role of the counselor, whether it is in schools or in private practice or in any of the other settings that we have our members a part of.
Absolutely. Everyone's always saying, when is the best time to get involved with advocacy? And the answer is always now. No matter what you're doing, work with advocacy is always appreciated, especially if you have a part-time legislature like we do here in Texas. Getting involved before the session begins, it's like getting your foot in the door early, and it helps those conversations become so much more familiar and easy when the session happens. So we encourage anyone who wants to get involved with advocacy to do it, to go out there and get those resources. There are your fellow counselors out there who are ready and willing to help you advocate for your profession.
Absolutely. Thank you, Noah, for sharing all the information.
And thank you, Leslie. It was such a pleasure talking with you.
Hi, everyone. I'm Gila Todd, the Director of Government Affairs and Public Policy for the American Counseling Association. Please join me in welcoming Representative Anna Escamani. Representative Escamani is a bold and unapologetic fighter for Florida families and everyday people. Born and raised in Orlando, she's the daughter of working class immigrants who came from Florida from Iran in search of the American dream. Anna went to Orange County Public Schools and the University of Central Florida. She holds a PhD in public administration from UCF. She made history as the first Iranian American elected to any public office in Florida and has championed critical issues like housing affordability, tax breaks for working families, environmental protection, equality for all, funding for public schools, human trafficking and sexual assault prevention, and support of arts and cultural funding. We're pleased to welcome Representative Escamani to our program today.
Hi, everyone. This is Representative Dr. Anna Escamani, and I'm really excited that I get to join you virtually to send my well wishes, but of course, also talk about the importance of advocacy for our counseling professionals here in the country and, of course, in the state of Florida and at the local level. So for those who don't know me, my name is, again, Anna Escamani, and I proudly serve District 42 in the Florida State Legislature. There are 120 State House Representative seats, 40 State Senate seats. So I'm one of those state lawmakers. I go to Tallahassee to represent our community and to fight for issues that define Central Florida, issues like good public schools, affordable housing, one job being enough, protecting our air and our water, and really trying to lift up all of our communities. And so it's not an easy job. It's also technically a part-time job in the sense that the legislature pays lawmakers a part-time salary of $28,000. So many of us who are not personally wealthy or retired do have separate day jobs as well. So with that said, it's a lot of work, but it's incredibly important, but you are a part of it. And here's why. When we go to Tallahassee, there are thousands of bills that are filed. At the end of the day, you are the expert on your profession. Anything that intersects with your background, in this case, mental health, social determinants of care and access, the intersections, right, between generational dynamics and mental health challenges with substance abuse and so forth, the criminal justice system, like all these issues that interact with one another, you are the experts in it. And so when bills are before us, your voice in helping to shape that legislation to prioritize for us what bills are important to your sector, to your field, what bills are damaging to your field, and to provide that lens as a mental health professional really is critical, especially when you have 120 lawmakers in the House, 40 in the Senate, who are not experts in every topic and lean on those around them to keep them informed, to make sure they're making the right decision, to make sure they're acting in the best interest of the great people of Florida. So your voice in that process makes a huge difference. What are some of the best ways to advocate with a legislator? So one, it's important to understand the process. In our case, as I mentioned, Florida has a part-time legislature. So we're only in Tallahassee for part of the year. The session itself is 60 days long. And then we have something called committee weeks, which are pre-meetings that take place prior to session. So in total, we're in Tallahassee for about 3 to 4 months. That's the time to meet with your lawmakers when you're in the Capitol. But when we're not in Tallahassee, you can also meet with us back in our districts. Build a relationship with your legislators. Take the time to figure out who they are, reach out to their office, ask for a meeting, and introduce yourself and your focus and the issues that matter to you, what your concerns are, what your needs are. And by the way, it's not just policy. Funding is the other point here. Our one constitutional responsibility as state lawmakers is to pass a balanced budget. And so obviously Florida ranks in the bottom as it pertains to mental health funding. And your voice can make a difference in changing that trajectory and allocating more of our dollars towards mental health, towards crisis intervention, towards preventative measures. And so advocating on funding alongside policy before session starts. And then, of course, in the Capitol, as you're doing right now on days of the Capitol, all of that has a huge, huge, huge impact. Storytelling. Storytelling is a very important part of this work. At the end of the day, when you're trying to inspire someone to join you in action and persuade a lawmaker to see the value in what you're saying, complementing those stacks, those facts, those professional insights with stories, with lived experiences, with real life patients, with real life scenarios, and whether they're tragic circumstances or really positive, uplifting ones or inspirational ones, personal storytelling goes a long way. And helping a policymaker remember what you shared while also, of course, helping to carry the bill forward or stopping a bill. And that's the third point I want to make for y'all. Sometimes we have to measure our success not by the bills that pass, but by the bills that we stop. Because I would argue there's a lot of policies that move forward that are actually very damaging to your profession, to mental health, whether it's bills that remove literature from our bookshelves, not allowing students to see themselves in their text, whether it's targeting of the LGBTQ plus community, restrictions on reproductive rights, of course, allowing insurance companies to do whatever they want to do and not putting more regulations around insurance companies, all of that, right? Oftentimes there's policies that are making a bad situation worse versus solving the problem. And so sometimes the act of storytelling, the act of advocacy is in opposition to something and not necessarily always for something. Obviously, it's much better if you can be proactive, but you also have to fight for your values and your issues regardless of the scenario you find yourself in. So be prepared for that as well. But when you are advocating against legislation, I'm a firm believer of calling people in before we call them out and trying to engage in dialogue and conversation about your viewpoint on a piece of policy versus showing up on day one in a public way of opposition. If there is an opportunity to talk to a lawmaker, talk to their staff first about why you have concerns about a bill, why this bill is something you should vote no on, please, please, please consider doing that. That relationship that you build, the opportunity for people to evolve and you play a part in that evolution are all key components of advocacy. But of course, once you try to call someone in and they're not responsive, then you do have to call them out. And that can take shape in not just testifying in a committee, but hosting roundtables back home that provide the opposition perspective, writing op-eds, letters to the editor, and or in the future, getting involved on the political side yourself, right? And supporting those that reflect your values. With that said, this is a difficult legislative situation. I'm putting it lightly. The world is on fire. Research dollars are getting pulled away from universities. There's attacks on diversity. We see decades of progress being wiped away. So I'm often asked, how do you keep going? How do you keep fighting? Why keep doing this? For me, one is that even when we look at parts of American history, not to say that we've gone through this before, because I do feel like this moment is uniquely challenging, but there have been moments of perseverance in the past, of resilience, of grit and grace, of fighting for our collective values and having to lose a couple of fights before you win. And so I think it's important to embrace the fact that this work takes time, that we cannot have ego in our efforts, that we have to be diligent and think long term in accomplishing our shared policy goals. With that said, what keeps me going and what helps me be effective are relationships and helping to find opportunities to work across the aisle on issues that are not partisan. And I mean, for example, when we talk about suicide and suicide prevention, typically, obviously a difficult topic, but typically one where we can find common ground on, where there's agreement across the board that this should be prevented. Of course, once you start talking about any type of access to guns and firearms, then things get more challenging for dialogue. But it's really important for us to work to find those areas of commonality and start there. It's also okay to practice incrementalism. Not my ideal, because we know what the problems are, we know what the policies are, let's go solve it. But incrementalism is better than nothing. And so it is important to also think long term of your strategy and create those midpoints, if you will, on your plan. So at least you're moving the right direction versus not moving at all. And finally, what keeps me going is folks like you. It's folks that have no idea who I am, but our success will make their life better. And so to really ground yourself in the people that you're serving, in the life-saving, transformational work that you do, and to understand that with advocacy, we can solve some of the most complex challenges everyday people are facing through systemic change. While you do work at the micro level, helping individual people, we have to advocate at the macro level to fix the systems so that people that you cannot reach, people that don't know who you are, people who maybe never even thought of seeking counseling support, can still get the path they need to live a wholehearted and healthy, happy life. So with that, again, I appreciate y'all. Thanks so much for giving the space to tune in. If you want to keep in touch with Team Anna, you can find us online at Anna for Florida, all spelled out with 2 N's, at Anna for Florida. And I wish everyone a fantastic day at the Hill, and I look forward to seeing you soon. Thanks so much.
Hi, I'm Maddie Stevens. I am the chair of the Pennsylvania Counseling Association's Government Relations Committee.
And my name is Dr. Joe Charette, and I am the current president of the Pennsylvania Counseling Association.
I am really excited to talk about Pennsylvania Counseling Association today and all the government relations work that we've been doing. Legislative advocacy is super important to the health of professional counseling. And I think one of our biggest successes thus far in the legislative session has been moving the counseling compact bill that Pennsylvania legislators have introduced. We've been able to move that through both chambers of our House of Representatives and our Senate. So much so that we're just waiting on them to determine which bill they're going to send to the governor's desk to sign. So my biggest goal for 2025 was to get the compact passed, and it looks like we're close. What would you say, Joe?
I would agree. I know there's a lot of excitement among the legislators that we've worked with who really helped get the ball rolling. Among all of our members too. One of the jokes that we like to make in Pennsylvania, we're really never the first to do something. We do tend to be behind the 8 ball on certain things because our system moves a little bit slower. So this happening in the way it is a really great achievement for us. We had to clear some roadblocks to get to this place, with great credit due to Maddie and her committee. So I would also be remiss if we didn't talk about the fact that we got associate licensure because of some of our committee's advocacy. So I think there's two great achievements to talk about there.
Yeah. Yeah. Getting the tiered license, that LAPC, was huge. And I think it really sets us up to look forward to further solidification and unification of our licensure. And I know we're talking about putting together a supervision credential, and we've got our committee working on looking at what that process would look like for us to set that up. So I think Pennsylvania's in a great position. So as far as how we organize the GRC, our Government Relations Committee, I am so lucky to have a huge committee. We have so many folks who want to be involved, but that also makes it difficult to organize people and to keep everybody engaged. So one way that we do that, we have about a 20-person government relations committee, and with the support of Joe, our current president, and the rest of the board, they've really sort of let me have the autonomy to organize the committee however I see fit. So we've created subcommittees. And so we've been able to break up that big 20-person committee into smaller sort of chunks. So we have a Pennsylvania outreach subcommittee, and those folks are in charge of keeping in touch with counselor education programs, keeping in touch with our licensure board, making sure that we are building relationships with other helping professions in the state, such as marriage and family therapists and social workers, as well as psychologists. We also have a legislative outreach subcommittee, and those folks are really focused on keeping us aware of what bills are getting introduced, what sponsorship memos are coming through, and helping us sort of build and maintain those relationships with our legislators here in Pennsylvania. We also have an administrative subcommittee, which is in charge of helping me stay organized and also helping us communicate with the rest of PCA and our membership what it is that we're doing via social media, via emails, and other modes of communication, also keeping our website updated. Am I missing anything, Joe? Oh, we have our events subcommittee, which Joe has spearheaded. So we have a lot of events that we like to do. We like to do a lot of advocacy events, such as planning a Hill Day. We visited our capital of Pennsylvania in Harrisburg in June, and our events subcommittee was huge in making that a reality and all the logistics. And then we also present at professional conferences. Most certainly, we always present at the Pennsylvania Counseling Association annual conference and talk about legislative advocacy and what it is that we're doing. But we also like to present at other conferences. So at ACA and at ACES, we have presented and will present to talk about the work that we're doing to sort of spread the good word.
Maddie, you pretty much added everything that I was going to say. But that's really one of the things that I think helps our government relations committee stay engaged and strong, is we make sure that we put them in front of our members in really key places. So every year at the conference, government relations does their own conference session to give some legislative updates, talk about how to get involved. They also we put them in our exhibitor area so they can talk to people about what they're doing, and even going. Maddie's really great at and the what's the committee that makes all of the marketing material?
Our admin digital.
Yeah. So those folks are really great at making like graphics and things that people can see to showcase our work, and we make sure that everybody knows what's going on. And then the Maddie, do you want to just spotlight the legislative tracker? Because I think that's actually one of our strongest things that we keep on our website.
Yeah. Great point, Joe. The Legislative Outreach Subcommittee also maintains, it's just a simple Google sheet that we link on our website, on our PCA webpage, and it is updated weekly for the most part, unless there's no updates to be updated, what bills are moving through our legislature and who's sponsoring it, the status of the bills, the committee that it's in, and with a brief synopsis of what the bill is. And we track only the bills that are relevant to the counseling profession and the helping professions at large. But that is a way for not only us as a committee, but PCA members to stay up to date with what's going on in the legislature in a really quick, like bite-sized way.
And sometimes we've gotten outreach, to the GRC to say like, "Hey, are you aware this was happening?" And we'll be like, "No, we're not, but better add it to the tracker." So,
Yeah.
because sometimes our members will reach out with that kind of thing if they hear about it first, right? Which is good. They want to be engaged.
And that sort of helps us stay abreast of like priorities from PCA members and what it is that we need to be focusing our legislative advocacy and our government relations outreach, what we need to be focusing on. So one other mechanism, in addition to tracking what's happening in the legislature, we have a formal way for PCA members to share directly with our committee what it is that they're seeing in their practice, in their daily sort of functioning as professional counselors. We created a simple Google form. Again, the link to that just lives on our webpage on the PCA website, and it's a ongoing needs survey. So it's just a simple way for folks to log on and share with us, hey, I'm seeing this. This is why it matters. And we check that monthly and talk about it as a committee at our monthly meetings in order to really set our agenda.
Maddie, I think that kind of speaks to the next question of like how do we prioritize our advocacy priorities with everything that's going on. We ask our membership what's important to them. Of course, we're staying in touch with what's happening at the state level and sometimes the federal level if that impacts the state level. But like many other places, a lot of what happens in Pennsylvania is regulated down even to the county or the municipality level. So we're looking at what legislation is impacting the practice, the educational programs, insurance in our different places. And we ask our members for what's going on. And that's how we organize those priorities. Which is great that we have members who are willing to share those kinds of things with us.
Mm-hmm. And also it allows us to be culturally responsive, I think, and socially just in the things that we prioritize. We're not only using the model of servant leadership by leading from a servant standpoint, and serving the people that really who are our constituents, but we're also thinking about what's going on Pennsylvania is a huge state. We've got big cities, we've got really rural areas. So we really need to have an idea of what's happening in all of those different communities. And I think that piece of servant leadership and really sort of leading from a place of person-centeredness and humanism, that's why I got involved with advocacy. I really think it's important for all of us to find our gifts and give them away to the world, in order to leave the world a better place. And I love talking to people, and I love being in front of a crowd and using my voice and sort of taking risks when it comes to using my voice. And so that's really what motivated me. And I had some wonderful mentors in my doctoral program at Ohio University. Dr. Tom Davis, Dr. Chris Bott, Dr. Jake Protivnak, Dr. Vicky Kress. They're all huge proponents for the counseling professions, and I just want to follow in their footsteps. What about you, Joe?
I think if you are sitting out there and you're like, where do I even start? How do I get involved? Go through your state association, and there's two reasons for that. Your state counseling association likely has the resources and infrastructure, just like we do with a thriving government relations committee, to guide you to the place where your strengths are needed in advocacy work. Also, and this is something that I know Maddie talks about all the time, go through your state association, because that's how we present a united front to the people we have to advocate to. The worst thing we can do in this work is look like we're fractured and like we're not communicating about the issues that are really important to us. So go through those associations.
Yeah. Thanks, Joe. I really love talking to you about this stuff.
Me too.
Welcome, everyone, and thank you for joining us for this year's Spotlight on States. I'm Dominique Marslek, and I'm joined by my co-host, Allison Rosenstock. This is ACA's chance to walk through the major legislative and regulatory changes that affect counselors on the ground. What we're going to cover today is more than just a list of bills. We'll connect the dots between what's happening in Congress, in the courts, and in state houses, and what it means for your practice and your clients. So we'll go to the agenda. Here's our roadmap for today. We'll start with a quick overview of ACA's government affairs and public policy team, who we are and how we support you. Then we'll move to big policy issues, the compact, Medicaid, insurance parity, federal and state issues like conversion therapy bans and AI regulation. And then we'll close with ACA's advocacy tools and how you plug in, take action, and join our Advocacy Power Hour. Introducing our ACA Government Affairs and Public Policy team. This is the group working every day on your behalf in Washington and across the states. We have Gila Todd, Director, Allison Rosenstock and myself serving as Government Affairs Managers, and Caitlin Flanagan as our Policy Coordinator. Together we monitor, build coalitions, meet with policymakers, and most importantly, bring your voice into these conversations.
Thanks, Dominique, for that great intro. Now we're going to dive in a little bit on the Counseling Compact. And ACA partnered with NCIC in 2019 to create and fund the Interstate Counseling Compact. And we began introducing the legislation into state legislatures in 2021. Currently, we're at 38 states plus the District of Columbia, and legislation is currently pending in both Michigan and Pennsylvania. So a little bit about the history of the compact is that the compact is a legislative process allowing counselors to apply for a privilege to practice in other participating states. And it also establishes the requirements for both states and individuals to participate in the compact. And counselors can apply for the privilege to practice if their home state has passed the compact legislation, and your home state is where you legally reside. So not where you work or where you may teach, it's where you actually live. And it also provides an expedited mechanism to obtain a new license when your home state changes. And also military personnel and their spouses can designate their home state. So for the compact, an LPC is defined as a counselor who's licensed to practice at the highest level in their state. So no matter what the name or designation in your particular state is, that's how it's defined within the compact scope. And the compact will address any adverse actions. So the compact is established and active, and the Compact Connect database is now complete, and individual states can begin utilizing the database within their current licensing system, and some states have started granting those privileges to practice.
This year, Medicaid has been one of the most active areas of policy change for behavioral health. Several states made telehealth protections permanent, including audio-only counseling, which is a lifeline for rural and underserved communities. We're also seeing states increase reimbursement rates for behavioral health providers, and that's encouraging because low payment rates have historically pushed counselors away from Medicaid. But the story isn't all positive. Credentialing delays, prior authorization barriers, and confusing managed rules continue to limit access. Finally, there's growing legislative attention on workforce recruitment, retention through Medicaid enhancements, which tells us policymakers know there's a shortage crisis. What LPCs need to know? In states with new rate increases, expect more demand from Medicaid clients because better reimbursement will draw in more providers. Telehealth expansions are critical for client access, particularly when broadband is limited or transportation is a barrier. And the key takeaway, Medicaid remains uneven. Counselors can't assume consistency. They need to stay up to date on their own state's enrollment rules, credentialing timelines, and reimbursement structures. When it comes to advocacy wins, we have some big wins to celebrate this year. New Mexico raised Medicaid provider rates effective in January. Louisiana followed in July by aligning rates with Medicare benchmarks, and Texas updated its reimbursement manual in August with new behavioral health rates. On the federal state side, Congress expanded telehealth flexibilities through September 30th. So we get audio-only coverage through September, but it's not permanent. And SAMHSA awarded 1 million certified community behavioral health clinic planning grants to 14 states and DC, a real opportunity to expand integrated care models. When it comes to next steps for advocacy, looking forward, we need to keep pressing states to preserve audio-only telehealth permanently. We also need to ensure that LPCs are included in every state's workforce development and Medicaid reimbursement increases, because too often the dollars are earmarked for physicians only. And lastly, we've got to engage directly with Medicaid agencies and managed care organizations to simplify credentialing and hold them accountable for access barriers.
Thanks, Dominique. So we're going to move on to a little bit more on insurance parity. So many states have enacted or updated their parity laws to ensure mental health benefits are on par with physical health benefits. And this year, some key areas of focus are reimbursement parity for mental health and substance use disorder services, elimination of discriminatory practices in insurance coverage, expansion of access to mental health and substance abuse disorder care, particularly in underserved areas. And specifically in California this year, they're making essential updates to the implementation of SB 855. So in July of this year, California's insurance commissioner finalized landmark rulemaking to enforce the state's Mental Health Parity Act. And this rulemaking mandates that insurance plans provide mental health and substance use disorder services under terms no more restrictive than those for medical or surgical benefits. And there is a federal state connection here. In 2008, the first Mental Health Parity and Addiction Equity Act was passed at the federal level. And last year, we saw updates to the rule that are being implemented now. Another big win this year was that Washington State strengthened parity compliance, and the legislation enforces timely responses from insurers and limits unnecessary delays in care. So states are the ones responsible for enforcing parity laws, and ways that you can advocate at the state level include reaching out to the state insurance commissioner, reaching out to your state attorney general, reaching out to your state Medicaid agencies, and joining coalitions in your state and even across state lines. So there's one really great task force that's operated by ACA members called the Mental Health Insurance Reform Task Force. It started in Kentucky, but they've expanded into many other states supporting counselors and other mental health professionals in insurance parity conversations. You can also find a lot of great resources through the Kennedy Forum.
Thank you, Allison. We love that coalition work that our members are doing. Talking about conversion therapy bans and federal state issues, at the federal level, the Therapeutic Fraud Prevention Act was reintroduced this year. If it passes, it would create a nationwide ban on commercial conversion therapy by regulating the spending of money on conversion therapy. That would standardize protections, because right now clients' rights change drastically depending on where they live in. Looking at federal litigation, the Supreme Court is now reviewing cases that could decide the constitutionality of these bans. The arguments are centered on First Amendment speech rights and religious freedom. One reason the court took the case is that lower appellate courts have split on the issue. That division is likely fueled by the rise of conflicting state laws, as we've been seeing, some banning conversion therapies and others rolling back protections. So the court is stepping in to resolve that inconsistency. Looking at recent state actions and rulings, despite the legal uncertainty, states are still moving in both directions. Some passed stronger bans in 2025, while others introduced legislation to weaken or repeal them. The result is a patchwork of laws that makes protections highly dependent on geography. The status of conversion therapy bans as of September 2025, 23 states plus DC have full bans for minors. That number has not grown significantly. But what has shifted are enforcement carve-outs and exemptions, particularly in states like Alabama, Georgia, and Florida. This shows that even where bans exist, the protections are fragile and contested. So what does this mean for risks and legal issues? The Supreme Court's rulings could reshape the landscape entirely, either strengthening bans or striking them down as unconstitutional. Even without the court, enforcement varies dramatically by state. Some states actively prosecute violations, while others don't enforce them at all. And if Congress passes a federal ban, it would override state laws, but only if the legislation is strong enough to withstand legal challenges. So what's the big picture takeaway? It's important to remember that ACA and all major mental health organizations do not view conversion therapy as a legitimate practice. When it comes to this, for counselors, the bottom line is instability. Laws differ by state. Courts are in disagreement, and the Supreme Court could change the rules against this term. And that's why ACA continues to advocate for federal and state protections, because that patchwork approach leaves too many clients unprotected.
Our next topic is AI and counseling. So, as a broad overview, this session, 4 states have passed sweeping AI legislation specifically on mental health chatbots. So, in Nevada, they passed a law that prohibits the use of AI for behavioral health in public schools. In Utah, they established protections for users of mental health chatbots. In Illinois, no one may advertise or offer psychotherapy services unless they are a licensed human by the state. And in New York, AI systems cannot make consequential decisions, including those related to mental health care. So, what's next? There are currently over 1,000 AI bills pending at the federal level, and there was also a provision in the One Big Beautiful Bill that passed earlier this year, which would have limited states' ability to pass any legislation regulating AI for 10 years. Luckily, that provision did not make it into the final bill, so these states are able to regulate AI themselves. So we also wanted to provide you with a list of AI resources from ACA, including the AI Working Group report that breaks down recommendations into practicing counselors, faculty, students, and more on our website. Also, we wanted to show you ACA's AI policy and what we're doing to make sure that ACA is involved in the AI and mental health conversation at both the state and federal levels.
So looking at what ACA's priorities are in 2025 and 2026, one of ACA's top priorities this year is expanding accessibility. That means supporting cross-state collaboration to improve parity enforcement and to break down barriers to care, particularly in rural and underserved areas. Telehealth is central to this push. If states don't modernize their laws to support parity and cross-state access, underserved communities will continue to fall behind. Another area of interest and priority for ACA is workforce development. We're zeroed in on workforce issues. The shortage of providers is one of the most urgent problems in behavioral health. ACA is pushing for new education pathways, expanded licensure portability, and more funding for counselor training. Military families are a special focus too, because their mobility often leaves them without consistent access to licensed counselors. How do our members take action? We rely on you when it comes to this work. Your voice as a subject matter expert is critical. That's where you come in. ACA's Take Action Center is live at counseling.org/act. That's counseling.org/act. It's the fastest way to engage with current campaigns and contact your legislators. And don't forget Advocacy Power Hour, which we host every third Thursday of the month for ACA members. It's a chance to stay connected, get updates, and strategize together.
Thank you, everyone, for taking the time to join us today for all of our Spotlight on States program and for our legislative update. If you have any additional questions, please put them in the Q&A box and we will get to them as quickly as we can. Thanks, everyone.
Thank you, folks.
Hi, folks. Welcome to our Spotlight on States. We are so excited to have Puerto Rico Counseling Association with us. We have Del Torres Rivera, Carlo Santiago, Victor Serrano Roman, and we're going to take it away. I'm going to let them introduce themselves and their position and how they are related to ACA work in Puerto Rico.
Thank you, Dominique. I'm the current president in functions for Puerto Rico, Asociación Puertorriqueña de Consejería Profesional, which is ACA branch here for the island. So I'm very glad to be enjoying with all of you.
Carla Santiago, I'm past president of APCP.
My name is Edil Torres Rivera. I happen to be a longtime member of the Puerto Rican Counseling Association, but also happen to be the 2023-2024 American Counseling Association president.
Great. Thank you so much. And thank you for your work. We'll just jump right in. Can you provide an overview of the work your state chapter and branch has been involved in the past year regarding legislative advocacy? So, just some of the work you've been doing for our members.
Sure. Over the past year, APCP has been highly active in monitoring and responding to legislative initiatives here in Puerto Rico that affect the mental health profession and the communities we serve. Our focus has been twofold. First, to support legislation that enhance access to quality counseling service, and second, to firmly oppose proposals that interfere with ethical, evidence-based practice and the quality of counseling services. Particularly those could negatively impact LGBT populations, vulnerable clients such as immigrants, and inmates with opioid use disorder here in our Ireland. We have issued several public statements, including official, what we call it, comunicados de prensa, which is press statements, which are outline our professional stance and advocacy positions in a clear way to pronounce us as mental health professions.
Thank you so much. Carla or Adele, do you have anything you'd like to add, or we can move on to the next?
I just want to say that before Victor came aboard, Carla was very instrumental to trying to represent the need for our profession. We're mental health counselors as well. We train, and I think that Carla was very instrumental to trying to make our voice being heard. Also it's important also to know that Puerto Rico has been involved in ACA conferences and ACA for a while. If I don't date myself, but I think it's been a little bit over 50 years in which the Asociación Puertorriqueña de Consejería Profesional has been very active in representing our profession in Puerto Rico, which we create the link between us Puerto Rican who are Latin people, to South America and to the Spanish-speaking world. Go ahead, Carla. Sorry.
No, thank you, Edil, for that introduction. Yes, while I was president here, the government tried to pass legislation to change our counseling law here in Puerto Rico. So I had to work together with my colleagues and volunteers from the APCP to pronounce ourselves against that law. So gratefully, we did have success on that job. So they didn't pass the law, but it was a hard work. So from that experience, I learned the importance that us as counselors to be involved in the state legislations, because sometimes we as counselors we just focus on our profession, giving services to the clients. But we also have to have in mind that part of taking care of our clients is to also get involved in state legislation. And that's something that I learned while I was being president. I mean, I heard it before, but I saw the need while I was president.
That's so awesome. Thank you so much. And I love how clearly passionate you are, and just how much all three of you bring to the table. Puerto Rico is so lucky. Um, can you just talk a little bit about any lessons you've learned, any challenges or obstacles you encountered when you were doing advocacy in the past year?
Well, since Carla make a precedent as a president for the APCP, this year I have more tools to get involved when it comes to advocacy for and public policy for in Puerto Rico. I'm sure she got more barriers related to that because it was not common for APCP to pronounce as a professional association when it comes to topics related to counseling in Puerto Rico, related to the clients that we serve, the vulnerable populations, etc. But right now, still some barriers related to politics issues that comes in matter, but are important to have those conversations with those in those levels of 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 the government, right, and legislative level. So in a professional and ethical way, to get involved with them, to be clear with what we want to communicate, not only for us as professionals, but also when it comes to situations that are related to mental health, are related to social justice. So we're still getting there. We're still learning from what we are doing, but I think the key is not to stop in that way. I think that we need to get more volunteers involved. So that part of education is very, very important because in a way that we educate for what we are elevating our voices, more people probably will get involved and will help us to achieve those that we are looking for.
Absolutely. I hope more folks continue to follow your lead. Um, And maybe one obstacle we can discuss briefly is how the testing in Puerto Rico has historically been difficult, and how some folks at ACA and perhaps Puerto Rico Counseling Association are working to ensure that the test in Puerto Rico is written in the Puerto Rican dialect.
Yeah, I want to just kind of throw something in that is very much related, and it's the issues that we have as professional counselors in the United States, related to our identity, related to what we can do, what we cannot do, and so on. It's pretty similar to what's going on in Puerto Rico, and yet the need for professionals like us, to continue to serve different populations that need, mental health services, school counseling, career counseling, all the things that we offer, and sometimes has been a little bit overridden by other professions. And I think that this is what Carlos and Victor have been very instrumental in the last few years, because I think that they finally start to kind of say, we're here, we can help. We know our training is such that we can provide these particular services. And of course, the idea that Puerto Ricans move forward and backwards between the main island and Puerto Rico and the United States, we have secret movement from New York, Florida, Texas, interesting enough, and sometimes even from Washington State, so we have this continuum kind of circular movement, which actually, when we get to the United States with our training, we easily get licensed. Okay. But, well, here in Puerto Rico, we're trying to kind of thing, which is probably why we're so interested in the compact. So anyhow, I shut up.
Yeah. I will say, let's begin specifically about the test. I won't say it was an obstacle because here in Puerto Rico, we are more than 4,500 counselors. So, and I'm giving you a random number, but that's an approximate of how many counselors are, and that have been able, most of them, to take the test and pass it. But yes, we will say it in the last 3 years, here in the island have been working with the test to adapt, is that the correct term to say it, the Spanish to our Spanish, because people will say Spanish is the same everywhere. No, Spanish, one is the Mexican Spanish, Puerto Rican Spanish, Spain Spanish, they have different words. So yes, the past years they have been working on it. However, that hasn't been like a huge obstacle for counselors to pass the test. But thankfully, yes, they have been working with the test, so new counselors been able to take the test, and I will say that in Spanish that actually speak or ask what it is meant to.
Mm-hmm.
That's wonderful. Thank you. Did you have anything to add before we wanted to move on to the next question?
Well, I will say that in addition to the test, is to have conversations with graduate schools, graduate counseling programs. Also, is very crucial. Just to be sure that future counselors have not only the knowledge and skills to success the test, but also to get in more multicultural and more advanced in evidence-based practice when it comes to the practice. But having that in mind, the curriculum is very crucial for each of those programs that are forming future counselors, because it will also have an effect, not only when it comes to the translation of the test, but also with that knowledge that they have in formation to get the test passed.
That's so great. And speaking of, tests and licensure issues in Puerto Rico, can you talk a little bit about your efforts on the ground to introduce the counseling compact and how that project is moving forward, and how you might view that impacting work in Puerto Rico?
Well, it start with Carlos as a president. So what we have been doing is continuing it. Having conversation at a legislative level, as I mentioned before, is kind of difficult when it comes to getting those follow-ups to have those conversations, to get them involved in. But education is the key. I mean, in a way that as much we are educating people on and having conversation at a legislative level. We started from there this year. It's kind of been difficult to get those follow-ups with at legislative level, but also a conversation with the consular examination board here in the island.
That will continue. We also spoke already with our board, the one who works with counseling here in Puerto Rico. So yeah, we have been uniting forces for us as island to be able to start working with what is necessary to be able to get in the counseling compact.
Yeah, the coalition building is so important. Thank you for mentioning that.
Yeah, I think that also the which is interesting is there's the I for whatever reason I came about to become president of ACA when Carlos became president of the Association of Puerto Rican Professional Counseling, and there was an interesting connection because we kind of saw the idea that probably we can start to help each other to trying to move the profession in Puerto Rico. And I think that the compact would be an excellent way to kind of do that. I actually start to kind of make my little move in terms of informing some of the, I do a little, kind of speeches, and I'm working with the University of Puerto Rico trying to get them accredited to CACRAP, so I think that, all these pieces seems to come together. And again, thank you for the leadership of the association who actually have been very instrumental in connecting me to those little points, so I think that pieces, seems to be working. And that's what we got you here too, Dominique, because you representing our beloved American Counseling Association, who actually kind of helping us to move to the step, but again, to the coalition that we have in the island to trying to move things forward.
Thank you. Oh, go ahead. I'm sorry.
No, I just want to get some of what Edil was saying. So thanks to ACA, to thank you, Dominic, for your support during this year, because those conversations with you had helped us to get more in action, when it comes to those legislative conversations that, as I was saying, kind of difficult sometimes for that follow up. But also, as I said before, we are learning also how to be conducting those conversations, how to get those follow ups. And you have been very helpful, and so I thank you, and thank you for the ACA for all the support.
Oh, well, thank you so much. That's so kind. And I'm so happy that you said that, because consistency, and education are like the biggest building blocks of advocacy. Finding a consistent way to meet and to move dialogue forward, just one step by one step, and figuring out ways to inform and educate the public and legislators, because you are the subject matter experts. You are the counselors, and so they're going to learn from you. So as we wrap this up, do you have any advice for your fellow counselors on how to get involved or how to be an advocate?
One of the most important things is to leave our profession. I mean, to be a counselor more than in counseling one-on-one therapeutic way to see us as a counselor is to get involved when it comes to advocacy, not only for our clients, but also for our profession. One of the main activities that we have been doing this year is to get involved with other professionals association like Asociación de Psicología for psychologists, with Colegio de Trabajadores Sociales, social workers. Also to get involved with La Asociación de Hospitales, which is Hospital Association for Puerto Rico, in a summit that they will be conducting in September for mental health summit, where it's going to be the first time that our association of counselors will be participating, next to the psychologists association, social worker associations. Also, Carla is representing our association in a movement that had been for the past years related to mental health professionals as well, for to get involved in different actions at different levels when it comes to mental health here in Puerto Rico. So it's important not only to provide the excellent services that I'm sure every counselor are providing, but also to get involved in advocacy and social justice, as I said before, not only for our clients, but also for our profession.
I will also say that, as I was saying before, yes, we are counselors and we do give services to our clients. But it's really important to have in mind that we have other roles in society that are important for us to cover, for being able to assure that those services are given to the clients that we serve. Law, the government are not apart from us. We are the professionals who works with mental health together with other professions as well, but we are the ones who knows what is need. We are the ones who knows what it needs, what it has to be done for those clients. I mean, a lawyer knows about law. Doctors in medicine knows about medicine. We are the experts in mental health. So we need to speak about what is needed for be able to give it to our clients. So it might sound basic what I'm going to say, but we need to be present. We have to have in mind that from our office, just giving services to our clients, we're doing just a part, an important one, but we are lacking in other important areas that we also need to cover. And is it scary? Yes, it is. And it gets you out from your comfort zone, but it's something that needs to be done. Who is going to explain to a governor, to a lawyer, to a judge, what's the need of that client if he's not the one giving services to him? So he needs that professional, us, to speak about what are those needs, what is important for our clients. And the only way that we are able to do that is by being there, getting involved, by speaking. So again, I have been scared. I mean, as president, I had many experiences that never crossed my mind that I was going to do. Being in the Capitolio, in the Senate, speaking with people, with really important people, and that make law in Puerto Rico. But at that moment, if I didn't do it, no one was going to do it because I was the one leading the association. So I had to be there.
Yeah.
And also being able to connect. And yes, we said it before, but I am conscious that I'm repeating myself, but we need to connect with our other counselors, with other professions, because by ourselves is going to be really, really difficult. Us as counselors teach our clients that they need support, that they need friends, that they need connections. So we have to apply that to ourselves. We need other professions. We need other counselors. We do need help. And when we need help to be stronger, we need to ask for it. So we need to speak. We need to be there. And yes, we need to get involved, even if we think it's not our concern. If it affects, affects our clients, guess what? It is our concern. And it is our responsibility to get involved.
Thank you so much. That was so beautifully said. I feel like you could do a training on this for our members. It was beautiful, very motivational. Adele, did you have any last words before we sign off for this?
Oh, I think that my biggest I'm very pleased that finally we get to this point in which we've been working hard for the last 50 years to make our profession be known as, and that we know what we're doing, and I think that finally we get usually most leaders just cannot do the time and leave. They don't leave. They just do their time and leave, So I think that I'm glad that I came across Carla and Victor, and they lead in the way they should be leading, walking the walk.
That's awesome. Thank you so much for your work in Puerto Rico. I can't think of anything more important than the work you're doing. And we are so happy that you took part in Spotlight on States. If folks want to know more about your organization, where should they go?
Oh, we have social media for Asociación Puertorriqueña de Consejería Profesional. Look for this logo and you will find us. But also we have a webpage, Asociación Puertorriqueña de Consejería Profesional. And you can connect with us directly through message or email by consejeriaprofesionalpr@gmail.com. and we will be very, very glad to be in contact with all of you.
Thank
And
you.
then if anybody, I think that the last year become a little more visible. If anybody want to know anything about our association in Puerto Rico, they can also get in touch with me.
It was great having you here. I appreciate your time.
Hello and welcome to our conversation. My name is Dr. Jordan Westcott. I use she, her pronouns. I'm an assistant professor of counselor education at the University of Tennessee, Knoxville, and former chair of the American Counseling Association, PPLC, Public Policy and Legislative Committee. I am so excited to be joined today by our two current co-chairs for ACA PPLC, and I would love for each of you to introduce yourselves, share who you are, a little bit about your roles both in and out of ACA to start us off. Dr. Pat, can we start with you?
Okay, so I am Dr. Pat Dudley, the current chair of the PPLC committee, and have been in advocacy both at the national and state level, as well as being involved with ACA in different capacities over the past several years. I am the past president of the Maryland Counseling Association. I am also adjunct faculty, and am very interested in how advocacy helps and assists not only the providers or the professionals who facilitate advocacy to get the word out on various issues affecting counseling, but also I am interested in helping clients to learn how to self-advocate. So I think that's important.
Awesome. Thank you so much, Dr. Pat. Thanks for being here. And Dr. Frank Goritz, would you introduce yourself?
Yes. Hi, I'm Dr. Frank Goritz. I am a counselor educator in the state of Florida and the recent past president of SAGE Florida. I've been involved in advocacy most of my life, and I had the pleasure of recently joining ACA, ACA's PPLC, I think last year, and engaging in advocacy alongside them over the past couple of years as we've been experiencing ongoing challenges when it comes to, legislation that impacts not only the profession, but also the clients we serve and the students who we are training to serve those clients. And I use he, him pronouns.
Like I said, thank you so much for being here and being a part of this conversation. And so, Dr. Pat, I'd love for you to kick us off with how you would describe the role of PPLC in counselor advocacy and in advancing the mission of the American Counseling Association.
So PPLC works to assist the GAP team at ACA in order to, how would I say, connect information that should be disseminated to counselors as well as counselor educators and other interested parties within the field. Additionally, PPLC works collectively to provide how do I want to say this, to connect counselors and counselor educators to any new or ongoing legislation that impacts the field. Hope that makes sense.
Yeah, I hear you talking about really PPLC being a connector between what ACA's government affairs team is doing and what the counseling profession needs to know about critical legislation and what they can really do to support advancing the counseling profession while protecting our scope of practice and the populations that we serve.
Absolutely.
Yeah. And I know both of you have exceptional advocacy stories, and I wish we had time to hear from both of you. So, Dr. Frank, I'm going to ask you, how did you come into advocacy?
I think coming into advocacy, I mean, it's part of who we are as counselors. And so I think it was only natural for me to come here to be a part of this movement. And as you'll, come to get to know us as a committee, we invite you to get involved as well, because this is also a natural part of who you are, even if we're not fully aware of that yet. But growing up as a queer minoritized person, advocacy has always meant a lot to me because I had to learn from a very early age what that meant. And so when I think about the counseling profession and people's traumas that they've shared around minority stress, I think we all realized in that moment how healing it is to engage in advocacy. And that really became the inspiration as to why I'm here today.
Yeah, so your experience as a minoritized person impacted by these policies that shape our clients' lives, but also the direction of our profession and the lives of those of us serving these populations. Like living that experience is really what prompted you to engage as an advocate.
Absolutely.
So, Dr. Pat, what advice would you have for counselors who want to get involved in advocacy too? You're both exceptional advocates, and I imagine you have a lot of wisdom to share about how folks can start their advocacy journey.
I would say get involved with the American Counseling Association. Reach out to join us. Reach out for the upcoming Hill Day that we have. Um, get involved because it's important and it's also part of our professional identity that we advocate for issues that will not only impact the profession, but will also impact the work that we do, the frontline work as counselors and as counselor educators. It's critical to get involved. Sometimes, and I'm speaking to, I guess everyone, but also students and interns. Sometimes it's scary. So sometimes it's scary to get out there and talk to people and let them know what your passion is and those kinds of things. But I say go for it because if you don't say something, then nothing happens. You're complicit with what is happening around you. Yeah.
Yeah, absolutely. And so I hear kind of a call to whatever advocacy looks like for individual counselors, like find that thing and start doing it because we really do need people at all levels. Um, and I think that that's a good transition to Dr. Frank. Could you talk a little bit about why state level advocacy is so important? Because I do think as counselors, we often focus on the broad national level, but we're most influential in our communities.
Absolutely, because within each state of the United States, we house various communities who have various lived experiences, but also diverse policies that, affect people and their daily experiences. Where somebody's life in Florida, for example, where I live, might be totally different than somebody else's life in Connecticut. Maybe it's because of voting rights. Maybe it's because of access to resources that one state has, the other does not. And being raised up in Sage's advocacy efforts and seeing firsthand state level advocacy, what could do in leading a state branch, it really helped me understand that every single state has things that we need to advocate for and advocate alongside. So that way we can make the living conditions and the lived experiences of the people in those states better. Because I think we do often forget, I hear what you're saying there. I think we do often forget that the United States is a huge place. And so state level advocacy allows us to be able to enact social justice change one step at a time.
Yeah, absolutely. And some of what I hear in that too, maybe between the lines instead of said explicitly, is that also like our state legislators represent a smaller number of people. And so our voice is bigger. And I heard you kind of hinting at that with this idea we can make this incremental change because our voices are larger in the states. And so I like what your reflections are about that piece and how our voice might be larger in these smaller contexts.
Absolutely. I mean, because it does take all of us in really thinking about what states can do. All of us, whether we believe it or not, are stakeholders in each state that we live in. And with that being said, that's why the PPLC is here nationally, because we want to be able to take every state's rights into consideration and all of the people who live in those states, and to be able to translate that into successful movements at a state level and national level. So that, like you said, the state legislators, are able to interact with us and we can interact with them on a more intimate level where we can address perhaps unique issues that impact some states compared to others.
Yeah, absolutely. Thank you. And Dr. Pat, thinking about some of what Dr. Frank was just sharing, what advice do you have for counselors working in this moment when things are so hard and people feel really demoralized? How can they maintain that motivation to advocate? How does being community connected play a role in that? It's a big question. So, kind of whatever immediately comes to mind.
Right. I think that we must practice self-care now more than ever. If we're not taking care of ourselves, then we're not able to care for those who we are working with, be it clients, students, etc. So that is one of the big things. But in terms of maintaining motivation, connecting also with other professionals, maybe that's getting together to do a Zoom to talk about the current issues that are impacting you, thinking about Frank was saying in your state and then trickling down to your community. Connection is necessary. We're not working in silos, we're working together for the good. So I think that's really critical that we connect with one another and also check on one another. That's very, very important. We have to check on one another.
Yeah, that's actually such a good tie-in to my last question for y'all because I hear that centrality of connection and community and how advocacy is a team sport, not an individual sport, and we really need each other. So then how can counselors who want to get involved with what PPLC is doing or want to know more about what PPLC is doing, what's the best way for them to do that? And that's really to both of you as co-chairs for this committee.
I mean, I would say reach out to us. Reach out to us and let us know what your concerns are in your state, in the nation, because we do want to hear from our people and work alongside the people. Just because we are the chairs of the PPLC, it doesn't mean that we reign over some kingdom and that we know what everybody's needs are. We want to be able to hear from you and work alongside you to help some changes happen, especially with the resources that are provided by ACA. I definitely think we can make huge differences together.
Absolutely. I totally agree. Reach out to the American Counseling Association. Um, PPLC is active. We're engaged. And if you'd like to get involved, not only in the PPLC, but also any other committee, reach out. And we would love to have you. We'd love to have you.
Absolutely. Pat, you quickly mentioned the importance of taking care of ourselves. And, I want people to know that reaching out for support and advocacy is also part of taking care of you. And I encourage you to also let us take care of you and provide you guys with that solace and support in being able to really understand what issues your communities are facing.
Thank you both so much for sharing this with ACA members. It's a joy to watch the work that you're both doing with the committee, and I know PPLC is in exceptional hands. So thank you for joining for this conversation and for letting me be a part of it.
I'm delighted to be with all of you today, and it's also my pleasure to talk about the Counseling Compact. I've been involved with the Compact for almost 7 years now and have been the project lead since its inception. We got started with the Compact a number of years ago, looking for an answer to the problem of how do we allow counselors to practice across state lines as easily as possible. And at an Association for the Counseling Board's meeting saw a presentation on compacts and sort of looked at each other and said, this is the answer to our problems. So we entered into a contract with the Council of State Governments and developed the compact itself, the legislation and the mandates for the compact. So what does the compact do? It does basically 4 really important things. 1, it allows counselors to practice across state lines. 2, it allows for telehealth. So regardless of what the telehealth regulations or laws are in your state, when a state joins the compact, this supersedes it and counselors can practice via telehealth within the state and across state lines. 3rd, there's a mechanism for expediting or swapping a compact license, a home state license, and a privilege under the compact if you're talking about 2 compact states. So I live in Maryland, which is a compact state. I moved to another state. Let's say I moved to North Dakota, and that then becomes my home state, but I've had a privilege there, and I can just, through the magic of the Compact Commission, can swap my home state license and privilege. And the third thing it allows is for military spouse to practice under whatever home state license they designate under for the entire period of the spouse's active duty. So as long as the spouse is on active duty, I decide that this state is going to be my home state license. My license is in good standing, and I never have to seek another license. Once my spouse leaves the military, then I have to play by the same rules as everybody else. So those are the four basic things that it does. Right now, we have 37 states in the District of Columbia that have joined the compact. We are actively working with most of the other states who have not yet joined, and there is pending legislation in several of those states. So we have hopes that we'll have a couple more states join either this year or first thing in the fall. And then we're talking with the remaining states. There is no state that has not expressed interest in the compact, but some have some higher barriers to overcome. There's one state that's a 48-hour state, and the compact requires that in order to participate, a state must currently license counselors at 60 hours. So there are some issues that states have to really address before they can join the compact. I don't think we'll ever get all 50 states in the District of Columbia, all jurisdictions, but I think we'll come pretty close within the next couple of years. So the way the compact works is that there is a commission, and the commission consists of one member of each member state's licensing board, and each state designates who that person will be. Generally, it's the governor's office or the secretary of state or someone in state government who makes appointments who designates that person, and they serve on the commission. So the full commission this year will consist of 38 representatives representing each of our partner entities. As a state joins the compact, they then have a commissioner who joins the commission. We also have 5 subcommittees that do the actual work of the commission. The total commission work runs once a year as a full commission meeting, but there are monthly meetings of the subcommittees. And obviously those are things like the executive committee, the rules committee, the finance committee, the compliance committee, and nominations and elections. The Rules Committee cannot make any rules that exist outside of the legislation, but what they do is explain how the legislation is going to work. So there are some things in the legislation that were left to the Commission's discretion. And it's the Rules Committee that then figures out what the wording should be for that particular rule, and then it goes to the Executive Committee for their approval, and then the full Commission has to vote on it. One example is what exams are allowed or required by the compact. The compact just said a national counseling exam, the legislation. What does that really mean? Well, the states use 3 exams. They use the national counselor exam, the clinical mental health exam, and the rehabilitation counseling exam. And so the commission made the decision. Those are the 3 exams that are permissible under the compact. Wrote a rule and it was passed, and that's where it currently stands. They're also writing rules around things like post-degree years of experience, how to expedite, do the swap with a privilege and a home state license and other things, just basically explaining the legislation. So we're hopeful, and it's looking very promising, that the commission is going to be ready to start granting privileges by the end of September. That's our target date. What do we call it a privilege? We call it a privilege because state licensing laws are very precise in what a counselor has to do to obtain a license. They have to submit their credentials. They have to be reviewed by the licensing board. They have to, in many cases, do an FBI background check.
pass a state jurisprudence exam before a license can be granted. The privilege is the legal equivalent of a license, but we can't call it a license because that's not how a counselor gets privilege. A compact, this particular compact, is a mutual recognition compact, which means that every state agrees to accept the license of every other state or jurisdiction that is participating in the compact. So counselors are granted a privilege to practice based on having a license in good standing from their home state, which is where they legally reside. They have to pass an FBI background check. They have to have no sanctions for at least 2 years. And if the state requires it, they have to pass a jurisprudence exam. And then a privilege is granted and they can practice in another state. Counselors will be able to obtain as many privileges as they want. That's up to them. There is a cost for each privilege. There are 2 sets of costs for each privilege. The commission is going to charge $30 for each privilege that is requested, and each state will set a fee. Some of them have already done that, and others will do that shortly. And those fees currently, among the states that have already made that decision, run from $0, where it won't cost a counselor anything, to $400, which is a state that requires their initial license is $400, and that's what they're going to require. So as you can see, it's all over the place, and it's up to every state. States make those decisions in large part based on how they fund licenses and what the state requires them to do and whether they receive any funding to offset license costs or not. So it is an individual state decision. Licenses and privileges, privileges are set to the home state license. So if my license renews July 1st every other year, say it renews July 1st, 2025, and I have a home state license from a state that has a 2-year renewal period, my next renewal period would be July 1, 2027. Between July 1st, 2025 and July 1st, 2027, I apply for privileges in 3 other states. Those privileges will become in effect as soon as it's granted, which should be a very short period of time. Within days, a privilege could be granted, but they will all expire on June 30th, 2027. When I renew my license on July 1st, 2027, I then have to renew my privileges for all of those states where I wish to hold a privilege. So yes, it is an every 2-year cost, or if you practice in a state, your home state license is in one of those states where it's an annual renewal, you will have to do that every year. But the good news is that it's your home state license that really dictates how you practice. And by that, I mean you are responsible for doing the continuing education required by your home state license and fulfilling all of those requirements. But for your privileges in other states, you do not have to do any additional continuing education. States have waived that, and they accept the continuing education that you do for your state. There are no additional requirements that are added on to your license, except, as I said, for the jurisprudence exam, if that's required. And many of the states that don't currently require jurisprudence exams are starting to look at those, so that may happen. So once the commission starts granting privileges, all of the associations involved with the compact will be sending out messages, and licensing boards will be sending out messages. So we're going to send out a lot of information on web pages, through social media, through every other media that we can think of. So we let counselors know that this is going to happen, that they can now start applying for a privilege. The Compact Commission webpage, which is counselingcompact.gov, will have the application on it. And I've done a trial run of that, and it's a very easy process to register, enter one's information, and then request a privilege. because the states are in the process of uploading their data to the database, that there's one database that's going to be used by the commission where every participating licensing board has to upload their information. Not every state is going to come on board by the end of September. Not everyone will be able to at the same time. A couple of states are having glitches with getting FBI background checks done or with getting their data uploaded. So states will come on probably more gradually than we originally thought would happen. So there'll be about half of the participating states will be able to come on board initially, with the rest of them being able to grant privileges as soon as they're able to. We anticipate that there will be tremendous response to granting of privileges. So just a couple of things about practicing in another state. When you practice in a state other than your home state, it is incumbent upon you as a counselor to know what the regulations, the scope of practice, the laws, any relevant policies and procedures are under which you practice. You have to practice under all of those guidelines of that state. So that's going to be slightly different for every state. Scopes of practice tend to be very similar, but some of the laws and regulations are very different. So as a counselor who wants to practice in another state, I would have to go to the licensing board webpage and make sure that I am familiar with all of the requirements for my practice. And that's one of the reasons so many states are moving to a jurisprudence exam, so that they can ensure that you're actually reading the state licensing law and understand it and how you're supposed to practice. But you also have a responsibility when you're working with clients who live somewhere in another state and where you may not be as familiar with the resources available should there be a crisis or the need of that, that you familiarize yourself with resources, that you get some information. So if something should happen, you have a way of providing assistance to your client who is living in an area where you may not be quite as familiar with whom to call or where to refer them for additional assistance. So that is also one of the responsibilities of the counselor. But we do anticipate that there's going to be tremendous response to privileges. I know everybody has been waiting anxiously for this, and everyone wants to know why it's taken so long. And that's largely because they had to develop a database. And I think when we started this whole process, none of us understood what it was going to take to create this database. It has been a learning experience for everyone, but I think we'll all be surprised at the ease of which it's going to operate. So, as I said, counselingcompact.gov. There's a lot of information on there. There's a lot of information on ACA's webpage. Go to the homepage. There's a link to information about the compact. We're always happy to answer all of your questions, and we look forward to having everybody participate in the compact. Thank you.
Hi, everybody. I'm Gila Todd, the Director of Government Affairs and Public Policy for the American Counseling Association. Thank you, everyone, for joining our Spotlight on States event. Special thanks to our ACA leaders and legislators who joined us for this event. Caitlin, what can people do now that this event and Hill Day has concluded?
Hi, I'm Caitlin Flanagan. I help with the government affairs team and federal policy. There's so many different ways you can get involved. Consider joining our advocacy campaigns on our Take Action page, and with just a few clicks, you can become a mental health champion. You could also request a local in-person meeting with your state or congressional offices. The GAP team would be more than happy to help you set up these meetings and provide you with resources like talking points and one-pagers. Just email us at advocacy@counseling.org if you're interested. You can also follow us on social media and like, share, and comment to help promote the voice of counselors. Keela, what are some events people can look forward to?
If you want to take your advocacy to the next level and continue learning about state policy developments, join our Advocacy Power Hour. It's every third Thursday of every month at 3 p.m. Eastern. The registration link will be posted in ACA Connect the week of the Power Hour. Also, our annual conference is also in Columbus, Ohio next year between April 9th and 11th.
Thanks, Gila, and thank you everyone for attending. We couldn't do this without you. Every time you engage like this and join an advocacy campaign, you're elevating the voice of counselors and helping ensure mental health care accessibility. Please be sure to stay in touch. You can follow us on social media and check out our monthly advocacy newsletter for more advocacy updates. Have a great day, and thank you, everyone.